It's a medical mystery. Lots of people say they want to be an organ donor, but it's not showing up in the figures. In fact, there's been a drop in the number of people donating in some states. The federal government has spent millions trying to turn those figures around. Now senior doctors say the issue is becoming critical. Medical reporter Sophie Scott has the story.
Dr Deb Veron is a transplant surgeon at a Sydney hospital. She's concerned about what she says is a wasted opportunity to improve organ donation rates.
What we've seen in the last 6 months is that some of the states are struggling to have the same donor rates as last year.
The latest figures from the Australian and New Zealand Organ Donor Register show in the first half of this year, the number of transplant recipients dropped in Queensland, Tasmania, South Australia, Western Australia and the Northern Territory compared to 2008 figures. Only New South Wales, the ACT and Victoria recorded increases over that period. Stanley Shaw had a liver transplant 10 years ago and now needs another one.
I'm not on the priority list, but the list is long and slow.
While the number of people who tick the box to donate their organs is high, doctors say that hasn't translated into more actual donations. 3 years ago, then Prime Minister Kevin Rudd pledged $150 million to address the low donation rate. Despite the funding, critics say the reasons for the drop in transplants include poor national coordination, little oversight of funds and inadequate training of doctors.
When the plan was announced in 2008, the target was for Australia to be leaders. And in order to be leaders, we have to put in the practices and systems of the leading countries. That's not what we're doing.
The Organ and Tissue Authority says it's satisfied with the progress made so far. It says every country with a high donation rate has taken a number of years to get there. Transplant doctors say as long as the status quo continues, the 1,800 people on the waiting list will just have to keep waiting. Sophie Scott, ABC News.